Good morning, everyone. We will get, I have to let them all in. To the lobby, let's admit all. Join the spotlight. Welcome, everyone, as you're coming in. Feel free to put your cameras on if you like. We will be recording this today, so if I can make sure that you're on mute, I think you're all automatically on mute. Alrighty. And is my sound working okay, Louise?
Yeah, sounds beautiful. Kia ora, everyone.
Cool. Okay. Welcome, everyone, to the Wellbeing Provocateur Series. Today we have Dr. Louise Cowpertwait. Welcome. And firstly, I'll just do a little introduction on myself for those of you who might not meet me yet. And then I will do the introductions to Louise and we'll get into the conversation for today. What I will ask is that what I notice is that when we have chat going on in the chat box, it feels like there's a little bit of a second conversation. So we will have questions and answers at the end. So I just ask you to really sit back, enjoy the conversation today. If there's anything that pops up, maybe you might want to jot that down. And then at the end, in the last 10 minutes of our session, we'll open that up for everyone. So sit back and enjoy. So I am Philly Powell. I am the founder and CEO of Wellbeing TIC, a workplace wellbeing accreditation program designed to really lift the standards of best practice workplace wellbeing here in Aotearoa and also across the globe. I come from an experience working in HR for over a couple of decades and found my sweet spot in this space due to my own personal passion for wellbeing and my own journey that I've been on, and really combining that with my HR profession to help improve the mental health and well-being of the workplace. Because let's face it, it's pretty grim these days. If we look at the most recent statistics that are out there, they just keep continuing to frighten me. But that's why we have amazing people like yourselves on this call today to really help out. So over to our guest today. So Louise and I met through a shared client last year, and we have since been connected regularly as we share very common goals in supporting and improving the wellbeing of our workplaces here in Aotearoa. When we met to discuss the topics of today's session, I was and I still am supporting several people dear to my heart with mental health challenges. Whoa. So I know it is really, really hard supporting people that you love. And it also gets harder when you feel helpless. And so it just felt like naturally our topic today, if I'm struggling with this, and I know how many people within my community, within the workplaces that I'm at, just need to watch the news. You just need to think about what's going on in the world over the last few years. Our topic ended up being demystifying mental health, because there is all sorts of language and connotations and stigmas and misconceptions. And then also how to really support others, because I'm sure that all of you here today have come with an interest in doing that. So Louise is a consultant clinical psychologist and neuropsychologist on a mission to support the mental health and wellbeing of New Zealanders. She's the founder and CEO of MindMatters Clinic, and she leads a team of New Zealand leading clinical experts in workplace mental health. She has become increasingly passionate about mental health and wellbeing through nearly 2 decades as well, experience in the sector, including her own mental health challenges, which I think makes her all the more credible when you have been through the trenches yourself. And like me, she's on a mission to see us talk openly about our wellbeing and to be able to access the right support when we need it. So welcome to the Wellbeing Provocateur Lounge today, Louise.
Thank you. Kia ora koutou.
Kia ora. So I would like to start you off in true fashion of this session is, what is your definition of a wellbeing provocateur?
I love the term, Philly. Great choice of word. And while it kind of brought images to mind, I actually looked it up on the Oxford Dictionary to try and make sure I was on the right path.
I love it.
And it said provokes disturbance and agitator. And I thought, that sounds fantastic. Those are my kind of people. So for me, when a well-being provocateur, I think about just talking openly about mental health and well-being, which actually is kind of sad, because it just shows that if that's provocative, we've got a long way to go. But yeah, that's what I would consider, for myself at least.
Yeah, and it is sad. It is sad that the conversations we have, I would say, are very shallow, and I guess I'm the kind of geek that loves deep conversations, but I feel like, the typical, how are you? Good, thanks. Really no one really honestly shares on a regular basis as to what's really going on. And imagine if we could share what's really going on, as to how much we could like connect and go, me too, supporting one another, that type of thing. So before we discuss your professional experience, can you please tell us how you spend your time when you're not working or sleeping?
Sure. So, I mean, firstly, because my job's so full on and I absolutely love it, like I get very excited, I'm very passionate, but it's also really intense. I find that in my time outside of work, I really need to defrag, or kind of ground myself. And I guess another thing I need from my time outside of work is, not only to look after my own mental health, but to have a bit of play, because what I do is quite serious, and I have a lot of fun conversations about mental health and wellbeing. Like today's, really looking forward to this korero with you, Philly. But yeah, so those are kind of what I need from what I do. And though what I do actually varies quite a lot. I like to have a play with those and change things around. At the moment, it's Sudoku and watching Killing Eve.
Oh,
That's
cool.
kind of some of my grounding time. Obviously, time with friends, time in nature, which I'm sure many people also do. And the fun, playful thing at the moment is going to a nail salon and getting the most ridiculous nails that I can get. So at the moment, it's like gold sparkles. And at first I thought, is this appropriate for the workplace? And then I thought, I don't mind.
Absolutely it is. The crazier, the better.
Yeah, embrace your inner child, I guess.
Yeah, and I love that the playfulness to balance the seriousness, because I feel like I'm in that space quite a lot. And I will admit to watching Married at First Sight last night. So just saying.
No judgment. This is a safe place, Philly.
Oh, cool. Now I was listening to this awesome podcast this week with Simon Sinek and the glucose goddess. So she's all about glucose and how you manage your glucose spikes. And she said this amazing quote that I just really loved: your best customers are the person you used to be. And so in our little introduction, it mentioned that how your experience in this profession is combined with your own mental health challenges. And I think to help people understand how you got to what we're going to get to soon, all these ologists and psychologist words that will kind of pull apart, is, can you tell us at a high level what mental health challenges you have been through?
Yeah, sure. So I guess people often assume when a psychologist says, I had my own experience, that that's why I went into psychology, which isn't the case. So when I first became interested in mental health and well-being, I was really driven more by a value of wanting to help and make a difference and support people, because I knew I'd come from a place of privilege. So I wanted to try and make a more equal playing field in the world. So that was my initial driver. But actually, I think looking back, I always suffered from anxiety, even from a young age. So I had phobias, like a needle phobia for a long time, that I then treated myself for after I qualified. But I wasn't really very aware of that. And I think there was also a period where I struggled with depression when I was a child, when I immigrated with my family to New Zealand. And there's lots of familial mental health difficulties in my family. But I thought that that was normal, that's which I guess it is to an extent. It was after I qualified and had been practicing for a few years, and I went through a lot of challenges at work. So hence my interest in workplace mental health. We didn't talk about mental health at work, our own mental health. We talked about kind of patients. So it was very like us, them. And I was also dealing with an adjustment, having moved countries, and I lost my mum to cancer as well. So I had a lot of different things happening at the same time. And I basically had what most people would call a nervous breakdown, where I experienced significant depression, anxiety. I had to take quite a lot of time off work. And yeah, it was a real wake-up call for me, actually. I noticed, and I love that quote, I noticed that it brought out a lot of my internalized stigma around mental health, even though I was a mental health professional. So I actually felt a lot of shame around, like, how can I, as a psychologist who's supposed to know all this stuff, become unwell? But anyone can become unwell. Yeah, so I think it made me a better clinician, a better psychologist, and also accessing treatment was really hard for me. So I went to the GP it took me a long time to be willing to go to the GP, and the GP basically got me to do a paper pen questionnaire and then told me it was mild and sent me on my merry way. And for me, being told I had a mild mental health condition when I could barely get out of bed and felt so hopeless and distressed was very invalidating. And I actually didn't go back. So I ended up recovering in other ways. But yeah, I think it made me appreciate when people are sitting with us and telling us as clinicians what's going on for them. That can be real make or break for whether or not people seek help and access the right support.
Thank you so much for your vulnerability and sharing that. It's really also sad to hear the shame around, being a psychologist that's experiencing, mental health challenges, and that feeling of being a fraud. Like, who am I to be a psychologist supporting people when I haven't got it together myself? But I think where I've come to at this point at 42 years of age is everyone's had their mental health challenge, whether it be minute or whether it be absolutely epic major proportions. And I think you notice that as you get older because, when you're younger, like, most, kind of carefree kids, you don't sort of notice that until you get to an older age. So back to your profession, you're a consultant clinical psychologist and neuropsychologist. I don't fully understand what that means. So I'd love you to tell us in your words what you do as you'd explain to a child.
Okay, I'll explain. All right, I'll have a go. And also, the funny part is, I don't think many psychologists or psychiatrists or anything really know how to define their profession that well. I think it's confusing for everyone. So if you're feeling confused listening or talking about those terms, then that's completely normal. I will break it down. So psychologist is somebody who specializes, who has an understanding or tries to understand by looking at the science and research, thinking, feelings, and behavior. So at the most basic level, human thought, feelings, behavior. Clinical psychology is the understanding of that, including being able to assess, assess and diagnose and treat mental health conditions. And then the neuropsychology part of that is understanding how the brain works in relation to those mental health conditions. So if you imagine, you asked me to explain it like I might to a child, if you go to your GP and you've, hurt your hand or something, the GP will, have a look, do an assessment of the injury to your hand, and then make recommendations for treatment. And if you want those recommendations, might put you in touch with whatever or do the treatment themselves. That's what a clinical psychologist would do as well, but for our mental health and well-being.
The first description of the psychologist, clinical psychologist, and neuropsychologist, like that, it just made complete sense to me. So thank you so much.
Oh, good.
I've never, like they just get thrown around. So hopefully people on the call are noticing that too. All right, we'll keep going. So can you, this is about demystifying mental health. So could you tell us the difference? And because I think that people throw around mental health that has a stigma, there's mental illness, there's all these different terms. So the difference between mental health and mental illness.
So mental health, I really like just thinking about physical health, because that's why, like I said, when I was talking about my own personal experience, I had all this shame around my mental health. But why? Like, why would I have shame about that? But if I've got tonsillitis, I don't mind, telling people that I've had tonsillitis and getting treatment for it. So I think if you're thinking about mental health, think about it similarly to physical health. And I really like the continuum model where we look at, there's a full spectrum of well-being, going from thriving at peak wellness right through to really significant unwellness, and we all move up and down that continuum depending on what's going on for us internally, so how we're feeling in ourselves and how our body and mind is, and externally what's happening in our context, which is probably why we're seeing so many an increase in mental health challenges at the moment, because there's so much happening in our environment that's affecting our well-being. So more people are moving down that lower end of the spectrum, and that's really helpful, because then we know that that's normal. And some of us might never get to the point that we experience significant unwellness or illness. We might kind of just move around that space, and that's fine. There's really just individual differences, but I guess it's just useful to know that that's normal. For mental illness, or some people might call that mental distress, to reach the threshold to be considered a clinical condition, you have to be unwell for usually at least a period of 2 weeks or more. And it has to be causing, like those changes in thoughts, feelings, behavior, or a combination of those have to be causing impairment in our functioning. So maybe we can't work, maybe our social life, we can't actually have healthy relationships at the moment, for example. So that's kind of the threshold. There's plenty of us who fall just below that threshold, but we do use a diagnostic kind of classification system in New Zealand. So that's kind of where the benchmark is for mental illness.
Yeah, and is that like a publicly accessible that you can read the criteria, or like the?
I don't know if you can look at, it's called the DSM-5 is the current criteria that we use in New Zealand. I mean, you could probably go to a library and see if they've got it. I'm not sure if you'd want to read it.
Yeah.
But you should be able to go on something like a health website, and like if you Google depression, like what are the symptoms of depression, you should be able to find that information very easily.
Yeah, cool. Gosh, 2 weeks seems quite short, doesn't it?
Well, that's why so many of us, like if we actually think about it, do experience clinical unwellness. Just like I said with physical health conditions, think how many of us in our lifetime are physically unwell at some point. Most of us. It's the same with mental health as well. Most of us will be in the milder end. So mental illness itself is often the illnesses like whether it's a depressive disorder, or I'm using very clinical language here, which I'm not, but that's a whole nother conversation. But that can then be classified as mild, moderate, or severe. And then the type of support you should have varies depending on where you're kind of falling along that continuum within the illness bracket as well. So most of us would be mild.
So to clarify and check my understanding, a mental illness is when there's been for a minimum of 2 weeks ongoing symptoms or things that meet the criteria for distress.
Yes, for most mental health conditions. There's like little niggly things depending on the like particular condition, but as a general rule, that's sort of a ballpark to go for.
Yeah, cool. And then there's lots of different language. So, I mean, we're using here mental health challenges. I made quite a conscious decision that it wouldn't be using the word issues, because there's quite a stigma around that, right? They've got issues, kind of like Paddy Gower's show or his ex show. And then, some people say suffering from mental health. Sometimes it can be quite hard to go, how do you sort of use that in non-clinical, just everyday conversation? How would you say that, is someone suffering from mental health challenges, or what would you say?
Yeah, I'm still figuring out so part of me, that provocateur part of me, fully, it's actually using quite evocative language on purpose when I'm talking about myself. So I say things like, I've got mental problems, or like I'll say things like that because I'm trying to reclaim the words.
Right.
But I wouldn't use that if I'm talking for or about someone else, because I don't know that that's the language that they want to use. What I've noticed, so firstly, you're never going to make everyone happy, and everyone's going to have individual differences. So it's good to be open, and if somebody says they don't like something, then you can adjust their language to what they feel more comfortable with. As a general rule, you've got sort of lots of groups or activism groups of people who have accessed mental health services or experienced mental health difficulties in their life. So they tend to use person first language, they call it, which is when you say, like you mentioned, I am experiencing depression rather than I am a depressed person, or Ari is suffering from schizophrenia rather than Ari's a schizophrenic. So that's in the mental health communities, that's the most common language that people use, which is quite different to the disabled people community, where they tend to use illness first language, like I'm a disabled person. And again, not everyone uses that language, but that's a trend, like that's the general kind of, and same with ADHD. People like I'm an ADHD or I'm ADHD, so they use disability or illness first language. But with mental health, it's sort of the other way around. And I do use words like mental health challenges, mental distress, mental unwellness, mental health difficulties. Those are the words that I go to.
Yeah.
The only thing I don't, it's a bugbear of mine when people say mental health when they actually mean mental ill health, because mental health is that whole continuum. So you can't have, what do people sometimes say? I've struggled with my mental health. Oh no, that kind of works. I can't think of an example, but just, yeah.
Yeah. I love taking away the I am depressed or I suffer from depression as to I'm experiencing depression, because I also think about some amazing people that I've met in my life that are thriving with depression. And so I think that really is the how do we have that real growth mindset, positive mindset around just because you have a mental illness doesn't mean that you can't thrive. Obviously, that's going to be ups and downs, but and we're going to get into ways to kind of manage it. So, I know it can feel challenging to know where to start to support people. So, can you give us a little bit of an overview from a broader context around mental health support?
It depends on if we're talking about formal or informal support. So I guess one of the first things I'd like to say is that, well, I've got my pulpit, is that we often forget social support, where our key relationships, our friends whānau or chosen whānau, that will be that even if you look at the research, that's one of the strongest predictors of how well someone's going to recover, or what their recovery might look like if they're unwell. Or like if they're, like you say, are just living with depression and they might move up and down that continuum. It's the social support that's the most important thing. So having those key relationships informally. I'm guessing the question is more around what formal supports are out there in the kind of mental health system. You're nodding?
Yeah. Well, maybe I just pause there for a second, because this is an interesting one on the social support. So I'm assuming that there will be a population of these people that don't have social support. So they're living alone, or they are don't have family, or they have very few friends. Maybe they're unemployed, out of the workplace. What would be your guidance there?
Yeah. Well, firstly, one thing I just picked up there with language is I tend to use we rather than they language, or us
Cool.
rather than, and it's something that I've started doing and I really like. So when I'll respond by saying when we are experiencing that, where we're very socially isolated and don't have key support people, one I guess way of thinking about that I really like is a strength model, where the community is seen as an oasis of resources. It was abundant with opportunities for social connection. So while we do have times when we're socially isolated, or at least many of us do, there are so many opportunities for connection. And sometimes we might need some support from maybe some formal support to try and identify those opportunities and test those out to start forming those relationships. It might be a church, it might be an iwi or marae, it might be a local community group, it could be an advocacy group. So it doesn't have to be an individual, but that's where we can start to form those really important connections. Also, my doctoral thesis actually was on social support and connection in its relationship with depression. And what we found was that it doesn't need to be face-to-face. Writing letters, because my thesis was a while ago, writing letters and emails and phone calls were actually just as strong in terms of their relationship for helping to prevent depression. And I think that's really interesting. So if you're feeling isolated somewhere, but you can still communicate with someone that you are close to that's far away, then use that as a social support.
I love that. And I'll share a little bit about my personal experience with loneliness. I've spoken quite openly about this in the past. So I am single, child-free, not puppy-free. She's barking in the background, so I hope you can't hear her. And I live alone most of the time. And that's been a real journey for me, and is really that was really probably what's been my biggest mental health challenge, is loneliness. And these days I feel like I'm like, whoa, I'm doing what she's saying, because I go to yoga, I go to the gym, I go to cacao ceremonies, I go to all weird and wonderful things that are in the community. So, quite often families and couples and stuff are busy in the weekends or whatever. And so I just keep an eye out on, Instagram, on event pages to see what's happening and like find my like-minded tribes. So yeah, and even things like I got a dog. So this morning I was just reflecting on how I said hello to 2 dog owners that I've become friends with on my morning walk, So I think getting out of the house, whether it's chatting to someone at the supermarket or on your morning walk or any kind of, even if it's just a smile. I know there's this famous story of how a guy was considering taking his life one day, and it was when he crossed the pedestrian and someone smiled at him that it made him realize that he was actually loved. It's just so powerful, the social support. So beyond the social support, maybe let's get into the more formal support mechanisms to help people.
Sure. So I loved your story, by the way, about it. Just sounds like you found the oasis of resources in your community.
Yeah, I love that. Totally.
And what opportunity, like you get to have opportunities, other people with their families who are, getting up at 8 a.m. for soccer with their kids don't get to have as well. So
yeah.
From one child-free person to another, I can see that. So the formal supports, and again, I'm probably going to revert a little bit to clinical language here, so bear with me for those who don't really like that language. But you know how I mentioned that if somebody is kind of diagnosed with a mental health condition, that they can be potentially classified under like mild, moderate, severe in terms of how, there's not actually 3 distinct chunks. It's literally just usually the number of symptoms that somebody has that fall under that bracket. But there's actually in international best practice guidelines, and these, you can look these up for anyone who wants to be a nerd and research these. There will be evidence-based treatments that we know are effective for each of those mental health conditions, whether it's depression, anxiety, schizophrenia, whatever it is. There will be evidence-based treatments, and they will differ depending on where you are along that continuum, whether it's mild, moderate, or severe. In New Zealand, we tend to really just have a GP as an option for primary care, which is like mild, or for the more severe end, we have mental health services that are connected to the hospital system. If you go to your GP, you should usually, for most of these mental health conditions, the first line evidence-based treatment is a choice between medication or a talking therapy that we know is effective, usually cognitive behavior therapy. At the more severe end, usually it's the combination of a medication and a talking therapy. When I talk about talking therapy, I mean an active program, kind of like when you're recovering from a back injury and you're engaging with a physiotherapist. It's not just someone to talk to. So those are kind of where we're at the moment. Usually if you are concerned about your mental health or someone's concerned about their mental health, they can go to their GP, they'll have a brief assessment with the GP, and they should be advised what their treatment options are, and then make an informed choice about what they would like to do, and then review how that's going after a couple of weeks. At the moment, talking therapy is not always accessible via your GP. There's a bit of a postcode lottery. So, and also some GPs just don't know to signpost people. And if you're really struggling with your GP, really, I suggest finding a different GP who has a good understanding and interest in mental health.
Hallelujah to that.
Yeah, I did for myself, and it's been a game changer for me,
Yeah.
And for lots of the people I've worked with. So if you're only offered medication, or someone you love is only offered medication, it's good to be mindful that actually if you're asking about what the evidence-based approach is, it's the option. And then some GPs you can get referred to for, often it's 6 covered by the public health system sessions with a cognitive behaviour trained therapist. If you don't have access to that, there's actually, it's called Just a Thought. They're free online. You can literally just Google it, programs that are based on those evidence-based therapies. There's really good research support, and I've heard good feedback for doing these kind of modulated programs that walk you through the skills. It's kind of like I said, with a back injury, having an app that walks you through a program rather than working with a physiotherapist. So that's all free and available to anyone in New Zealand, and is very specifically targeted. So there's one for depression, there's one for sleep disorders, which we haven't talked about, one for generalized anxiety disorder, which is a type of anxiety. The problem with us as us being in Aotearoa, New Zealand, is that there's a gap for people who are in that more moderate kind of stage, and also in the severe. And what people often find is they don't have the support, the level of support that they would like or need in the mental health system, because it's just so overloaded, and a lot of the people working there are really burnt out as well. Yeah, that's kind of.
Can I just go back? So you said GP, medication, or talk therapy, and then you mentioned CBT. So that's not psychologists.
It can be psychologists. So if you're, I'm going to talk a little bit about who talking therapists are, because I think that would be really helpful. A counselor. So firstly, CBT isn't the be all and end all, because as I mentioned, there's evidence-based therapies, but there's also choice and personal choice. And some people prefer what might be considered like second line treatments, but they've got a preference for those for some reason. Or some people prefer complementary therapies or culturally based therapies that are not less evidence-based. It's just coming from a different evidence base, like rongoa for Māori might prefer rongoa treatments for depression, for example. So just that caveat that I feel I really need to add.
So I just asked you a question on the, so you said second line, and then I think complementary.
Yeah.
So the second line would be, what do you mean by that?
Yeah, so if you're thinking about, let's go with depression, because it's so common, right? With a major depressive disorder, which is when we talk about depression, that's really what we're meaning, the classic depression.
Yeah.
The first line of treatment is an SSRI medication or CBT for depression, which is a talking therapy for depression. If the first SSRI doesn't work, for example, there's a second line of treatment, which is like the next evidence-based treatment. So you basically rank the treatment options according to which has the strongest research-based, and you can work your way through the different treatment options. So that's really helpful, because then people know that if they've tried something, it's not the end. There's actually loads of different options that they can try. So that's what I mean by second line of treatment. And when I talk about complementary therapies, I mean ones that don't necessarily come under the international best practice guidelines, but they're very Western science models of how those are developed. So there will be other therapies that people might find very therapeutic and prefer to use that aren't necessarily like the evidence-based therapies, like yoga-based therapies. People might prefer those as well. Does that help clarify that for you?
Yeah, so we've got talk therapy and CBT, and then I think where I'm confused is, and maybe people on the line are, so there's psychologists, there's counsellors. It's still a bit confusing.
Yeah. that's the next thing that I might talk about.
Cool.
So we've talked about kind of, you've got first, second,
Yep.
complementary, you've got mild, moderate, severe. You also have different types of talking therapists. So
Got you.
don't worry too much about what type of talking therapy, because there are so many out there that really you should just go to the best practice guidelines or ask the GP for the advice. Don't feel like you need to know all the different types of talking therapy. I mentioned CBT because it's the most common one
Got
that
you.
appears, but there's
Yeah.
lots and lots of types.
So it could be, for example, NLP practitioner, or it
Yeah.
could be, I mean, what's your thoughts around spiritual guidance, psychics, mediums, intuitive healers, that kind of thing?
Well, you might argue that that's a complementary therapy. My
Okay.
thoughts are I wouldn't use them for myself personally, but that doesn't mean that somebody else might not use them. But the only thing to be aware of is they're not practicing under any registration body that has a code of ethics. So I have worked with people who have used those therapies, and actually it's created harm because of the advice that they've been given. And so that's my only worry about those things, is just make sure that you really trust who's providing that support, especially when you're in a vulnerable place or your loved one's in a vulnerable place.
Yeah.
The counselors are essentially somebody to talk to. So they're more like you're formalizing that informal support. Some counselors will have some skills around talking therapy approaches, but don't think about counselors as treating a mental health condition. And I think that's where people get really caught up. I use counseling for myself, not as treatment for anxiety, but as just to support me at the moment with some of my own mental health challenges. But if you're looking for treatment for a mental health challenge, your best bet is to go for a clinical psychologist or a psychiatrist, because they're trained to assess and treat, and they know the evidence-based approaches. Some psychologists who aren't clinical psychologists may also have that training, but ask first, because you don't know. And the difference between a clinical psychologist and a psychiatrist is a clinical psychologist is kind of like the physio who's giving you the talking therapy exercises and that kind of treatment. The psychiatrist is a medical doctor who's trained in assessing and treating, but you have shorter appointments. They're usually like 15 minutes or half an hour, and you tend to get more medication. So they're useful to talk to if you feel like you need more than what your GP can give you. Like there's some medical complexities around the medications you need for your mental health. They're also more expensive. So counselors are about $110, $140 around there for someone to talk to who might have some skills but not treatment. Psychologists are about $180 roughly per session to $200, and they are not necessarily trained to treat, so just ask first. Clinical psychologists are usually around $200 a session and are trained to treat and assess. And psychiatrists are like maybe $400 to $500 to see them, a bit cheaper for follow-up appointments. So yeah, hopefully that kind of gives you the picture of
starting to come together now. So it's almost like GP, there's medication, there's talk therapy, and the medication sort of goes through the psychiatry path, and the talk therapy is more like the psychologist, clinical psychologist path.
Correct. Yeah.
Yeah, and there'll be some complementary therapists. And I mean, let's say there will also be pharmaceutical interventions and nutraceutical. So that's a whole nother rabbit hole. But I think that, again, there's some good research out there. Do your research, trust who you're, I mean, I work with a naturopath. Things work for me, but I'm not, I would say, my mental health is pretty good right now, and it would ever really be in the mild end, so I don't need to go to that extreme. Let me pause. Okay, I think, so you mentioned some costs, and you mentioned that if I went to the GP, I could get 6 free sessions with a talk therapist.
Depending on your GP.
Depending on, yep. So what other free options do I have? Like, do you have to always pay for psychologists, clinical psychologists, psychiatrists? How do we get them for free, or don't we?
So counsellors you can sometimes access for free by your EAP program, your employer assistance program, if you have a job that has one. If you use Xero accounting software, you can get that for free as well.
Mm-hmm.
They have an EAP program. Universities and polytechnics will have access to counsellors as well. Community organisations. So if you Google like free counselling, subsidised counselling in your area on Google Maps, you might find some local community organisations who offer free or heavily subsidised counselling as well. For talking therapy treatment with a specially trained psychologist, a clinical psychologist, or a psychiatrist, there's not really any free kind of available access. You might be able to access those sessions through your GP. You can access the Just a Thought programs for free online. Some health insurers will provide a limited number or amount of support towards that. And some universities have clinical psychology training programs who have a clinic you can access subsidized sessions for. Gumboot Friday is also available for people up to the age of 25 who have funded, so they cover the cost of some counselling, and I think there's some clinical psychologists on their platform as well for younger people to access a few free sessions. So yeah, that's kind of where we're at in terms of covered, like cost covered or reduced cost offerings.
Yeah, and are you aware whether EAP providers amongst their counsellors have psychologists? I just can't remember.
Some do. It really depends. The thing I would warn you, I guess, about with is ask if it's a psychologist. If it's not a clinical psychologist, ask if they are actually trained in the evidence-based approach. So if you take anything away, it's really about being informed about what the evidence-based approach is, and then you can make a choice about what other things you might want to do, like naturopathy, but it's an informed choice because you know this is what all the best practice guidelines and research says works. I do or don't want to do this. This is how I'm going to access it or not. And these are the other things I'm going to do to support myself or the person you're supporting might choose. That's the bit that I want to caution people about. So if you're using an EAP counsellor or psychologist and you're wanting a treatment, make sure that they can provide that treatment for you.
Got you. Now, recently when I had someone that was as you kind of alluded to earlier, basically like a nervous or mental breakdown. Is that still 2024 language?
I don't know. I use it for myself.
Okay. I think people
I just
understand.
use the words other people use.
Yeah. And actually, I think I did read somewhere, might have even been in Louise Hay's writing, but, you know, like the nervous system, like breaking down, it really makes sense to me. Now I've just lost my train of thought. Bear with me a second. Oh, it was a goodie too. Bear with me. Recently supporting someone. And what happened? Okay, I'm going to have to... Give me 1 second.
One of the things we haven't talked about, maybe this is it for Leah, is around supporting others. So if you're someone supporting someone else, was it around that?
Yeah, well, it must be, but we'll go into it and then maybe it'll come up. So where did I get? Sorry, I'll just check my notes again.
No,
okay, so actually we have been talking about medication, talk therapy, all of that stuff. That's right. You're supporting someone and they've had a, mental breakdown, and they are so low that really trying to even get them to listen to you about, hey, this is the path, to get to the GP, or, don't even want to do that. So yeah, any guidance on, because I guess it's the individual. At what point, how do you force someone to go to the GP, or how do you what's your advice about helping people that are really rock bottom?
Yeah, well, you can't really force. The only thing that can force someone to and even then you can't force someone to receive treatment, but it's the Mental Health Act. So if somebody is deemed to not have the capacity to make those decisions, if you're that concerned, then you really should be talking to the community mental health team or local crisis assessment service.
Yeah.
So have a conversation with them, tell them what's going on. But always talk to the person. So what I find helpful is saying exactly what you're seeing, what you'll notice, what you've observed, and just trying to understand what's going on for the person and what supports they might be open to. Because not looking after yourself or hopelessness or no motivation is part of the when we're unwell. So it's sort of part of the picture. But yeah, we can't really force anyone. And the thing I really think is important is we know where our responsibility begins and ends as well. Like we're so hard on ourselves, and it's so stressful and sometimes really scary if someone's that unwell. And actually, if we've done everything we can do, all we can do is just keep that door open and just keep checking in and saying how concerned we are and just trying to make sure they're as safe as possible.
And we didn't really touch on the more, critical end. So I know you've mentioned the community mental health crisis team, the CAT team, they're called, right? Yeah. So from previous experience, I have been told that I can't actually get any help unless the person has actually attempted to take their life. So interested in the guidance around if someone is having suicidal ideation, who do we call? Where's the help in that arena?
Yeah, so you don't have to have attempted to access crisis services.
Okay.
So I'm not sure if that was bad advice.
Obviously, yeah,
that you
bad
got
advice.
given.
God.
Yeah, so when I mentioned at the severe end, the teams connected to the hospital, the crisis assessment team are part of those teams. So they're the people who are kind of 24/7. And if you need to find the number, you can just go on Healthline, or you can look up local crisis assessment team number and find your local
We can put them in the show notes.
Yeah. So, and now I've lost my train of thought. What was the question?
Okay. Oh no, I don't think there was a question. What we'll do now is, so medication, talk therapy, we've talked about the more critical end right now. How do we get our loved ones to understand the importance of routine self-care? And I think this is where I was kind of going. It can be, quite challenging when people are not motivated and feeling really, depressed. So what would be your guidance there?
Yeah. Well, firstly, I mentioned the strength-based approach before talking about our communities, but that's true for us as individuals. We naturally move towards growth and healing. So I think thinking about that, if somebody's really at their lowest point, and you need to find out what it is that like get some of that motivation, even if it's the smallest amount. So maybe it's about meeting them where they're at. That might be as simple as, today, do you think you could get out of bed and get dressed today, or going for a gentle walk just around the block, whatever it is that's achievable for that person. And that might be as small as making a cup of tea for themselves. So and again, I mentioned just listening. So saying what you've noticed, sharing that you're really concerned, and then saying what do you think you need right now? People kind of know what they need often, and they will be able to tell you, but it just might be a lot smaller than what we want. We might want, be wanting them over here already when we're not ready yet.
Yeah, that makes sense. And the next question is, you sort of alluded to this, that it can be really common that the people supporting others, their mental health is compromised too in the process, particularly when we're not talking that it's been a couple of months, it's been year upon year where it's ups and downs, but I guess maybe overall not really a lot of progress or change. What are your tips for caring for ourselves in the process?
Well, one of my first tips would, and honestly, so much of the stuff I learned the hard way as well. I don't even think I'm talking as a clin psych. I'm talking just about myself and well, actually through my work with people, what I've observed as much as what I've been taught intellectually. Boundaries are so important. So when I say boundaries, I mean intentionally thinking about what your limits are and what you need. So knowing what you can and can't offer, and just being really clear about that. So if somebody wants you to do something that day and you are depleted, just do it the next morning or do it when you can do that. So being willing, and it's really hard to do this when you're worried about someone, but being willing to say no or say yes, however it's going to look like this. It's good negotiation when we're supporting someone, especially if it's a longer term situation that's we can get quite burnt out. The other aspect is I mentioned being intentional about what we need. So really thinking and planning your self-care, not just saying I'm going to do self-care, but looking at your diary, looking at all your life commitments and demands, including the support that you are giving someone else, and thinking what can you do, even if it's the smallest things that you can do to look after yourself. And what that needs to be for you will be different to what that needs to be for somebody else. So getting to know yourself and knowing what things help keep you afloat, even in times like really challenging times, like when you're supporting a loved one through significant mental health challenges. And the last thing I'll say is if you imagine like circles of support, so in that inner circle is that person who's going through that crisis, you're kind of their second circle out. Ideally, there's not just you, there's one or at least one other person so you can share that support. And if there's not, then maybe think about that oasis that I was talking about before and how you might be able to start to unlock another support. Outside of that is your supports, the supports for those people. So have somebody, at least one person that you feel comfortable talking to about what you're going through that's not related to that person, because then they're separate from the situation. So yeah, those are my little tips and yes.
That's really helpful to just think about who is that maybe more independent person that you can confidentially debrief, defrag. I love that term you used at the start. I wanted to be provocative and kind of also flip it the other way. I've been talking a lot about, I talk about it a lot, is around, taking a mental health day as not wagging, is my latest saying, or taking a mental health day, or mental health leave as sick leave, period. And so what I guess I would provocate is that when someone in your life, whether that's a friend or a loved one or family member, is, experiencing a mental health challenge, take the day off work, take the afternoon off work, come into work later and help them go to an appointment at the GP, because that's what that sick leave is for. It covers domestic, and I don't really care if it's not someone domestically living in your house. If someone needs you, someone needs you. So that's where I'd say, just flipping it to, if you do have the capacity. And I guess I say that because when people are in a really critical position, you just never want to feel guilty for not giving them enough support. Gosh, that's quite deep, isn't it? Let's now open up the questions and answers. So feel free to put your questions in the chat. I did just remember one that I am going to start off first. Actually, no, we've got one from Heidi. So such high risk for health, well-being, spiritual coaches, healers to cause harm from an unregulated and unregistered place of practice. Do you know if there is a collective piece of work to raise this with regulators in New Zealand?
No. So great question, because I have been concerned. I've been concerned about this, but also about people who call themselves doctors when they're not doctors, which I've seen. I've seen all sorts of dodgy practice counsellors who are giving diagnoses where they're not qualified to. And it doesn't seem to be any way that you can really do anything about it so if they're registered with a board, then you can complain to the board and they investigate it and take it really seriously. There's the Health and Disability Commission, but same thing. If it's not actually a health provider, then it's a real wild west out there in terms of regulation. And that's why I think having that trust, so first knowing what the evidence-based approach is, and then if you're going down a more complementary route or with an unregistered provider, having that trust. And actually the trusting relationship with a talking therapist predicts outcomes of the talking therapy as well. And I've seen similar research on GPs. So trusting anyone is actually really important.
Yeah, and that's the most common thing I hear, is that people go to a counsellor or a psychologist and they don't resonate with them and then they just give up. I see that happen quite a lot. So definitely encourage, if it's not working, then find the next one. The other question I had is, I keep on losing it. We got any more questions?
Unless anyone else on the call, sorry, is aware of any way you can flag these issues, because I'm actually talking just from my personal experience. I did check this with the Medical Protection Society legal team as well, but there's a chance that here we go.
HDC do take complaints regarding coaches working outside of scope. It's the time of someone unwell to do this. Yeah. That's what I remembered. So when I was looking for support for someone recently, I can't quite remember the details. I think I ended up on like a psychologist or psychiatrist something co.nz website. So there's a place where you can search for them in New Zealand. Is that correct?
Yeah. So you can go on the New Zealand College of Clinical Psychologists, have a Find a Psychologist site if you're looking for a clinical psychologist. Talking Works is a good website if you want to find a counsellor, but there's also plenty of psychologists and clinical psychologists on there. There's also Psychology Today, where you can find people as well, and you can search by what areas they specialise in as well. If you want someone who really specializes in what it is that's going on.
Cool. So we'll put all these in the show notes, because I think it's I really love how you've clarified, what sort of the first line of support, where to go, GP, the routes there, what's available for free, and then clarified where it's not free, and some resources and stuff for us to go to, and places where people are at more critical risk. So that's been really, really helpful. And Anne just asked, what was the website Louise referred to earlier that has specialised info for different mental health issues or challenges?
So there wasn't one particular website. I really like the NHS, but I'm a little bit UK orientated. So the NHS has really good, like easy to understand information. And I believe to Aotearoa, there was like different health websites in New Zealand that you can find information as well. Just a Thought is the website where you can access free CBT courses, which will basically treat depression and specific anxiety disorders and things like that. Kia ora, Sue.
There's also Mental Health Foundation have a really great list of mental health conditions.
Oh, yes. So Mental Health Foundation has a wealth of resources, and they also have a really good page, Find Support, which is really helpful if you're supporting someone else. It lists all of the different services and offerings, depending on what the issue is. One thing I forgot to say, Philly, and it's going to bug me if I don't say it, is ACC also offer psychological treatment, so talking therapy treatment, if you are injured. So if you have a mental or a physical injury, it can be worth seeing if you are eligible for psychological treatment through that route as well. Mental injury is a bit tricky. You have there's certain
PTSD, criteria. Isn't it? And it's quite limited.
Yeah. But still, there's that you can inquire if you have an ACC injury of some form.
Yeah. I know that there's definitely some work to be done in that space around ACC and mental injury. And I know that there's a guy called Josh Darby, firefighter or from Fire and Emergency, doing some amazing work here in Aotearoa with some people. Someone's asked Yolandi, do you need a referral from a GP to see a psychologist or psychiatrist?
No.
Cool.
But I would say do see your GP, because the reason why is because sometimes there's actually physical factors that are causing what looks like a mental health condition. So, and this has often happened. So any good psychologist or psychiatrist who sees you should make sure that you've had the routine blood test, urine test, because things like thyroid functioning or low B12 or low iron can look like depression or anxiety. And actually, if you treat low iron, it then goes away. So it's quite important to have that just basic screening done.
And so said GPs are providing an increased number of HIP practitioners. What does that stand for?
Health Improvement Practitioners. So this is part of a government initiative to try and increase access to those evidence-based talking therapies.
Someone mentioned that they were going to see one of them this week. I now know what that means, and I can Google that. Excellent. Oh, thanks for sharing the depression.org. Great website. we'll gather all of these in the show notes. Has anyone got any final questions before we round out this morning's kōrero? Now, the great news is I've been using AI, and obviously there's transcription services and Teams, but that means that there's going to be some really great takeouts and notes and resources in the email that we'll send out with a link to the recording. Also moving this over to Spotify, upgrading to a podcast. So there'll be heaps of access to everything that we've covered today. So be able to add to your notes that you've been scribbling down today. And then we've also got a little update here: mental injury as a result of your physical injury or psychological injury as a result of a sensitive claim only for ACC. Thanks for that update there. Anything you'd like to, anything you added one more before, any last kind of wrap up words of wisdom from you today, Louise?
Oh, I'm not sure about words of stuff.
Oh, yeah.
But I guess I just like to say, like, my mission or my hope, and I do believe it's possible, is that wherever we are on the mental health continuum, that we will be able to access the right supports that we need and feel like it's an empowering experience. I do think that that's a possible future. I do think our community, each of us as individuals, our social networks are that oasis of resources. And I think just don't give up hope. Don't feel like we're just stuck in this broken system that's never going to get anywhere. There is hope. There's some people like Philly doing incredible work. And keep up the good work and look after yourselves along the way.
And also, before we finish, how can people find you or work with MindMatters?
Feel free to connect with me on LinkedIn. I lay low on social media. That's part of my own self-care, but I am on LinkedIn, so feel free to connect me. I love to connect with people there. You can go to our website, mindmatters.clinic, and all our contact information and information about our services that we offer on there as well. So yeah, love to hear from people.
Thank you so much. That was so informative. And yes, I love that oasis of a community. That just is beautiful terms. And thank you everyone for coming up today. We'll send out the email with all the details and all the resources. It's been amazing. Enjoy the rest of your day. Ka kite.
Ka kite. Thank you, everyone.